Hey everyone, it's Colette. How are you? For those who are new to the channel, I will introduce myself. I'm a nationally board certified functional medicine health coach. I help people improve their gut health. I help people recover from mold toxicity, and I help people optimize or balance their hormones, and helping people let go and focus on 5 steps so that they can establish better health and better habits as they age. So wanted to talk today about insulin resistance and hormones. What is insulin resistance? Okay. So it means when you're resistant, your body is, hi Jessica, how are you? Where are you listening from? What state are you in? So insulin resistance is you're resistant to the hormone insulin, right? Which basically increases your blood sugar. And insulin resistance can lead to type 2 diabetes. So if you've heard that term, oh, you're in Westerville. Okay. Yeah, me too. So that can lead to type 2 diabetes. And we hear that term thrown around a lot. I'm insulin resistant. I know you. You know what I do? Sorry. I don't think I recognize your middle name there. Your maiden name, I should say. So sorry about that. I was looking at it quickly. So insulin resistance. Oh, yeah. Let's talk then. Message me afterwards. You can set up a call with me if you want. Insulin resistance can happen because of aging. As you get older, you can become more insulin resistant. Nobody talks about that. They just talk about that the body, that you're in this situation, you're pre-diabetic, go ahead and change your eating, change your lifestyle. Well, those are 2 really important factors, and I work a lot with people on those to understand what is it they need to do. What do they need to change? How can they do this? How do they fit it in? And why are they doing this type of thing? But here's what I'm going to tell you. Insulin resistance can also happen when your hormones are not optimized. And the other thing is insulin resistance is tied to high blood pressure. So let me tell you a little bit of a story. So my mom was under a lot of stress because my dad had actually had cancer again. And she didn't have enough techniques or strategies in place to manage the stress. It's kind of hard, right? Not sure if somebody's going to make it. And she's more of a type A personality. So she has a tendency to get a little bit more stressed over things. She found her blood pressure slowly creeping up, and then it jumped up to the point that it was so high. She was so concerned about heart problems. And we were talking to her about like breathing and those types of things to do, which breathing can help. But one of the things and she went on medicine and she kept going on medicine. It wasn't working. Because there's a couple things that are connected. Insulin resistance has been researched and connected to high blood pressure. One of the doctors I love is Dr. Tina, Tyna, that I follow, because she talks a lot about this. Is it the insulin resistance that drives high blood pressure, or is it the other way, that high blood pressure drives insulin resistance? There's been talk about both directions. We do know they're connected. So when you have high blood pressure, I want you to also look at, am I still dealing with insulin resistance? Is this because I'm in my 40s, I'm older, and there are some things that I have not addressed in my health that's causing my body to be more insulin resistant? Do you have extra weight around the middle? Those types of things. It was interesting. I was walking today and ran into my neighbor who is about 70 years old. Just happened to be chit-chatting. And I don't know how we got on the subject of health. Sometimes it happens with me a lot. And she was telling me she was going to go to the doctor for her high blood pressure. And I said to her, do you realize that's tied to insulin resistance? And she said, that's funny because I have insulin resistance and I'm pre-diabetic and I know I've got to be super careful. Do you know anything about that? So she is actually going to, wants to start working and co-create her wellness plan, which we're going to work on specifically. You're welcome. We're going to work on specifically in the future to co-create her wellness program so we can get rid of her insulin resistance and lower that blood pressure. So I do work with people on the right habits that will change your lab results. I also have partnered up with some different functional medicine doctors that I can refer you to ones if you need additional testing or additional things. Sometimes I think it takes a team approach. When you are dealing with insulin resistance and you're dealing with high blood pressure, you say, what am I starting with first? Honestly, it has to do with what is the most important thing at that moment, meaning what is causing the bigger symptoms? Where are the numbers? What do things look like at that moment? And what are you dealing with? If you're under stress, then stress could be causing a lot of these things. We know insulin, cortisol, all of that can be caused with stress. I was just talking with actually a functional neurologist today that we're going to be partnering up. So you'll hear more about that. And I'm going to be helping some of his patients. And then that was telling me so often he'll tell his clients that, and he's also a functional medicine doctor. He'll tell his patients, like, the first thing I want you to do is go out and have fun. Bring up your joy level. Reduce your stress. And that's the first thing I want you to do. How I got connected with him is my husband. I hired him for my husband. And that's the first thing he gave my husband is homework, which I loved. We forget about that. We're in this very quick, fast-paced culture. And so much of what we're doing is causing so many of our health issues. That slowing down and understanding how these things are tied in are super important. Now, the other thing I will tell you is if you're constantly snacking, that can increase and spike your insulin. So as we age, as we get older, that constant snacking isn't something our bodies support. Now, I don't want you to have shame or guilt around that. I can teach you how to eat for your hormones. I can teach you how to eat for your health, how to have better health, better habits. So we'll change your lab results or just give you more energy. Your digestion gets better, all of those things. And we're talking about blood pressure and insulin resistance. So all of those things can change by a lot of the stuff that I do with my clients. And that just looks like you reaching out to me, we setting up a discovery call, which is, I call them health recovery calls, which is about anywhere from 15 to 30 minutes. We figure out if it makes sense to work together. I tell you a little bit about how I work. And then from there, we create a program. So we get you to your goals. And I will tell you, people that sit on the call with me always feel better after they get off the calls. So with this insulin resistance and with this blood pressure, it isn't a matter of just taking pills anymore. It really is a matter of digging deeper, working with someone like me to focus on the diet, focus on the lifestyle habits, up your protein. Remember we talked about 0.8 to 1 gram per pound of weight that you are. So you're going to think of like 150 pounds. It's going to be 0.8 to 1 gram per 150 pounds of weight per day. So usually people are around 30 grams or so. Lifting weights, that doesn't allow that. That's going to help your body too, right? With the reducing the snacking, addressing the hormones, and then really starting to look at your stress levels and other lifestyle habits. We can co-create that plan. But I want you to start realizing that sometimes it's not just high blood pressure. That and when you're keep throwing pills at it and it's not budging, there's other things that you need to address first for that number to come down. And it might be like peeling back an onion, but here's what I'll tell you. It's harder to stay stuck with symptoms like high blood pressure that can cause a heart attack and cause other issues than the other hard, which is to start and change your habits and change some habits, change some thinking, and start working on things that will start changing those numbers on your labs and start changing your life. Here's what we know. We know genetics. If people say, well, I'm genetically predisposed to high blood pressure or being insulin resistant, we know genetics is a small piece of the puzzle today, because what loads the gun and fires it is your diet, your lifestyle, and your environment. And we know now that your eating can actually change your genetics. Let me say that better, can change how your genes are expressed. So you won't end up with some of those issues if you're addressing some of those other things, or you're less likely to. We never know for sure. So if that's you and you need help, don't feel bad. Like, drop the guilt, drop the shame, and come see me. Reach out, send me a message, drop a comment below. Let's set up a discovery call that's free. Let's see if it makes sense to work together. Let's talk about what your wellness plan can look like. Let's talk about what your goals are and get you to that end result. So thank you so much for joining me. Have a fabulous day. Would love to hear your takeaway below. All right, take care. Bye.